Hey, welcome back, everybody. It's the one show everybody can't wait to tune into. A simple guide to a healthier life that we call simply Health Simplified. And today, well, we're going to talk about some topics that are probably near and dear to people my age here. Let's give you some idea what we're going to chat about here today. So, we're going to talk about a topic that affects millions of men, but rarely gets discussed openly. We're talking about male pelvic health and how physical therapy can be a game changer for conditions that many men suffer from or with in silence. If you're a man between 40 and 75, like me, this episode is for you. We're going to break down what the pelvic health physical therapy program actually is, the conditions it treats, some surprising statistics that might shock you, and most importantly, how to know if you might benefit it. All that and more from the man who does know, Dr. Justin Fesler. Welcome, sir.
Thank you, Paul. How you doing?
I'm a little choked up on this one. I said, I don't know if I really want to do this show or not here today. I told you my famous joke here that with my father, who passed away a number of years ago, heart attacks, problems, stroke, and he and I had a discussion late in life, and he said, wait till you get to be my age. I said, Dad, I'm just not going to do it. I don't know why you're doing all this stuff. I'm not having male health, pelvic health issues.
Well, it's not too scary. It's and knowledge is power, right? So the more we know, then at least we know what questions to ask, and hopefully, if you have any symptoms related to this kind of condition, that after the show, you're going to know kind of what those symptoms are and what you can do about it too.
That's the key. Too many men my age just want to stick our head in the sand, and I don't want to hear about it. I want to go to the doctor. Right. I don't want to know about it until it's too late.
That can be a disaster too.
That can be. So tell us. I'll drop out. Let you tell us. I'll ask a few questions along the way, but I'll let you tell us what is male pelvic health.
Yeah. So pelvic health is a kind of a sector of the physical therapy treatment. We treat women and men, but a lot of the information out there is about women and the conditions that happen with that, postpartum, prepartum. If you have a baby, a lot of women have issues there. So, but we're going to deal with the males today. A lot of people, with whatever symptoms they get as they start to age, as far as maybe urinary incontinence, start to dribble.
Don't start tuning out, guys. I can hear you right now going, listen to this.
And then, issues with the prostate, all the complications after prostate surgeries, erectile dysfunction, all these kind of things are things that we might deal with in pelvic floor physical therapy for males.
And are men embarrassed to talk about it? Because honest to God, I got a lot of male friends. I'm an old, I got guys I've known for 100 years. We don't talk about any of this stuff.
Yeah.
And yet I know because it's happening to me, it's got to be happening to them.
It's huge. Yeah. No, they don't talk about it. And even doctors, when men go in, from what I'm hearing, aren't kind of bringing up like, oh, you should go to pelvic health physical therapy. You can help these conditions. They're just like, you're getting older and whatever. And so a lot of it maybe lays, it's on, the onus is on me or the other therapists out there to get the word out that, these are things we're treating and kind of educate the community a little bit. But it's unfortunate because people will suffer. Males in general take about 4.2 years to seek help for their pelvic floor condition. Before they'll actually try to do something about it.
I know this isn't a show about me, but I will say I just went in for my annual physical, and the guy said, anything going on? And I saw this show, and I said, I kind of have to pee faster than I used to. I can't hold it as quick as I used to.
Yep.
And sometimes that's a problem. And I'm embarrassed to say that. And he's like, he wasn't shocked, but he didn't really give me any advice. I'm just supposed to go to a urologist or something. Or whatever.
Yeah, which is, a good start to go there. Some urologists do refer for physical therapy and some don't. So it's good. This will be good for people to know, even if they go to a urologist and get a diagnosis and stuff, that you can still do something about it that's not a medication or, some kind of big procedure or something. You can try therapy first.
If not for this show, I would not have mentioned it to him.
Okay.
I would have just sucked it up and said, I got no problems.
Yeah.
So you're at least empowering me to talk about it here.
Yeah, and some of the problem with that, before I get into everything else, is, if you start to change maybe your liquid intake, your water intake throughout the day, because you're like, I don't want to drink now because then I'm gonna have to go to the bathroom so many times. That's a vicious cycle into dehydration, which our body does not do well when we're not fully hydrated. So those are kinds of things that, you get unhealthier over time because of these symptoms, because you adapt your life to it, and that's not a good thing. So good. It's good that you
help
thought of
one
bringing it
person.
up. There you go. One. That's all we need. So and basically we just want people to know that if you have these symptoms, don't wait any longer to get out and tell your practitioner about it, so that you can start getting help. Within usually, 5 to 8 sessions, we can usually start seeing some improvements. And I'll go into more detail as far as for each condition, kind of what that looks like.
Okay. And again, I wouldn't think of physical therapy as a place to go solve it. I guess you go to a specialized,
right,
a urologist or something.
Yeah, and you do, and they can do a lot of the high level or surgical interventions, and prescribe medications that can be helpful as well. But a lot more of them I've noticed in the last couple of years have been, referring to us, and we do pelvic health physical therapy in our clinic. I've noticed that there's been a increase in the number of referrals from them, which means that they're getting the word out, and patients are talking about these issues more. So that's great. So
let's dive into it.
So what's the pelvic floor anyway, right? I mean, what does that mean? So the floor of anything is the bottom, right? So we're looking at this basically hammock type structure that's composed of skeletal muscles. They're contractile, but they're also, muscles also can relate or react to stress and tighten up over time. If you have prostate issues, things like that, or bowel issues, those muscles can either be too tight or possibly too loose. Or not coordinated. So in other words, if they're not coordinated, then you're not going to have the proper function in terms of your urinary system and your bowel system, and possibly erectile issues as well. So
and that's the only one I ever hear about. That's what they advertise all the time in television, and most guys don't even want to talk about that. But I have heard of
erectile dysfunction. Yeah, is that what you said? Yeah.
That's gotten a little more. I remember years ago when they started the prostate exam. It wasn't. It wasn't that long ago that was part of the physical, and that really changed a lot of people's minds to touch it, to talk about it. To do this.
I know. It's just an area that people just don't even want to talk about. They want to go there, like keep your finger away from me.
Exactly.
So I just want to go into kind of as far as the physical therapy aspect of this for these kinds of issues. We're going to be dealing with strengthening the pelvic floor with certain exercises, maybe relaxation techniques as well if they're too tight, which is oftentimes the case, and then exercises to help with coordination. So coordinating, so that if you sneeze or something, you're not going to have an accident. You can time your coordination and coordinate your contractions to prevent leakage, stuff like that. So
boy, and you just hit another. I didn't even tell him that. Yeah, if I sneeze or something suddenly happens, something leaks out here. It doesn't react the same way.
Yeah. So if you're getting weak down there, or if there's tension around that pelvic floor issue that you can't relax completely, then those can create issues with urination and or the fecal side of things too. So
that side too. Oh my goodness.
Yeah, it's both. Yeah. So and other things that we do in pelvic health physical therapy. So we'll do manual therapy, which is basically externally. There's some things we can do to the hip rotators. I know. So externally, you can work on kind of the low back, the pelvis, a lot of the pelvic muscles, the hip flexors, the piriformis, the obturator muscles, all these muscles that are hip rotators. So all that area down there is like an onion. So you got layers of tissue. The skeletal muscles, if they're tight, they affect the muscles of the pelvic floor as well. So loosening up those muscles, a lot of what we do is stretching and doing manual therapy to loosen up those muscle groups. Helps people to be able to tap into their pelvic floor a little better, contract better, and to be able to relax it better if they're too tight. So then other things we do are, some breathing mechanics exercises. So diaphragmatic breathing, we do that in concert with doing maybe some Kegels if people are weak down there.
What's a Kegel?
A Kegel is a contraction where you're contracting your pelvic floor. So for males, it's basically if you're going to the bathroom, so you're urinating, if you stop the flow of urine, the pelvic floor muscles are the ones that stop the flow of urine. if you walk into a cold lake, these are some of the cues we give people to tap into their pelvic floor, and imagine as if you're trying to raise your testicles away from that cold water.
Yeah.
So those are your pelvic floor
I grew
muscles.
up in the Midwest. I know
Yeah.
what that's like.
Yeah. And the last one that men do not like to hear is try to shorten your penis.
What?
Literally. So that cue has been seen in literature to induce the best contraction in the pelvic floor muscles. So when you try to do those various activities, as you get that imagery in your head, it's going to help to contract those pelvic floor muscles, which helps you to regain continence over time.
And
So
you
we
mentioned this with fecal too. That's a polite way
Yeah,
to say
yeah.
I have trouble pooping here or
yeah.
something.
So some people get, either constipation, or you can have,
I have suffered from that. I know other friends have it. And then you straining, and now you're
Right.
getting hemorrhoids and other sorts of your that can lead to, because it's all just
Yeah.
muscle related.
Yeah, and I would say, just as a side, is stay hydrated,
Yeah.
because that's the number one way, just naturally, easy thing you can do is stay hydrated, and possibly get a fiber supplement. You can talk to your doctor about that too.
Talked about both of those.
But both of those
how
things
much
can
water
help.
should I drink?
They say
everybody
8
has
to
a
10
theory.
glasses a day.
Wow.
Something like, it's a lot. I mean, it's like half your body weight in ounces.
How many people?
Yeah.
Everybody listening, raise your hand if you do. See, no hands went up. You do.
Yeah, one of two of us. 50% of us do.
Probably. Yeah.
So that's definitely important too. So we will go into, with these patients, dietary recommendations. We have a sheet we give out that bowel irritants or bladder irritants, things that can affect your ability to or your urgency that you might feel with these issues.
See, I'm not trying to give you an ad here, but that is what impresses me about your service. I've been to physical therapy before, usually when I did some damage to my knee or I tore something or whatever. So the doctor recommended. They don't ask me anything. They say, "What's your problem? Your calf, your
Right.
ACL, your knee or something." They do some exercises focused on that, and they send you home with some things to do, and that's about it. There's no discussion of lifestyle or diet
Yeah.
or how
There's
this
two
might-
things to that. It's possible either they don't know, what to do,
Right.
or they don't have the time. They don't feel like they have the time to go into, maybe 10 minutes talking about that stuff. But
I think it's both, because you've
Yeah.
actually, when you told me you went to USC and got a real doctorate in this whole thing. Do most physical therapists, I don't picture them having that level of training.
yeah, so these days, almost every therapist coming out of school is coming out of a doctoral program.
Wow.
So
okay.
it's very common now. Yeah, probably when I came out of school, it wasn't as common. It was
Right.
just starting to be a thing. And now it's almost everybody. So
So that's, but then it's the time, because they've been referred and they got whatever, 10, 20 minutes they're going to spend with me. Not a lot.
I think so. Yeah, that's probably part of it.
And
I don't know. I'm not in their head, but that's
and
I'm
that's
giving
one
them
of
an
the things
excuse
you guys
there.
do
So
longer. You guarantee that
we
you're
do
gonna get-
40 minutes every session. Yeah.
Okay.
So maybe we'll go a little bit into the conditions
Yeah,
that you might
please.
see. So everybody knows what a prostate is. The prostate's that, it's a little organ around the urethra as it goes down. If it gets, later in life, we get hyperplasia, which means the prostate grows, it gets too big. And eventually you can have it occluding the urethra, and so you get restricted urine flow. And so that can be an issue. And then the other unfortunate thing that can happen is you get cancer of the prostate,
Yes.
which is
Number one fear. of
more and
men.
more common now, unfortunately.
Right.
Very treatable if you get it early. But some of these prostate surgeries are going to affect that urethra. You literally, if you're doing a prostatectomy, you're taking the prostate out and you're reconnecting the urethra, so it shortens that. So it affects a lot of times you're going to have symptoms like urinary leakage after that, which means you're going to leak many times throughout the day, especially in the beginning. Sometimes that can take up to a year to get through that process.
Wow.
But as you'll hear in a minute, we're going to go through with physical therapy. We can drastically shorten that time frame.
I won't take the time here, but I'd love to do a show on just prostate, because that is something men are aware of.
I can go into a lot of detail there too. Yeah, that would be great. And then, so we've got the prostate issues. So 14 to 25% of men report bothersome leakage after prostatectomy. So almost a quarter of them do.
I never had that, but my late father went through that surgery and same complaint.
Yeah. But if people go through physical therapy for it and do the exercises as recommended, 88% will achieve
Oh, my goodness.
good results within about 3
I
months,
thought you were going to say 20% or
and
30%.
only 56% if you don't do it. So, you're getting a B plus if you go to the therapist, and you're almost 50-50 chance if you don't. So,
Yikes.
Chronic pelvic pain syndrome. So that's another thing. Could be related to the prostate as well. These are things like penile pain, testicular pain, pain around the groin area, the perineal area, which is like around your anus and under your testicles area. So a lot of people have these pains. I know. Yeah. Well, good. That's good. Then you don't have it. So
right. But again, it's a topic I've never even heard people talk about.
Yeah. So let's see. I'm just going to give you a couple stats here. So approximately 2 to 6% of men have chronic pain in the pelvic region.
Oh, wow.
Yeah, and a lot of that is related to prostate issues, and then things that we can actually help to change over time with pelvic floor physical therapy. So what else we got? Okay, erectile dysfunction. So that's another thing that can be affected by your pelvic floor too.
I remember when the late Bob Dole, who ran for president, came on and did an ad for that, and we were all shocked.
Was that for Cialis or Viagra or something?
Viagra or something. And I mean, for him to come out and talk about this, he was like a guy's guy. He was,
Yeah.
And I thought...
Did he still have the pen in his hand?
Yeah, well, he used to, right? Because he had a severe injury.
I know,
and his whole arm was almost blown off. So he would hold the pen just to kind of hold his arm.
Keep it in place. Yeah.
But so when he started talking about it, we all got to talk about it. My dad started talking about it.
Yeah, it's good. It's, and that's helpful when celebrities come on and talk about things that are difficult to talk about. And you're like, oh, I guess maybe it is kind of normal to talk about it. And then you can get help. Yeah. So it's good. So basically for erectile dysfunction, we're looking at doing things like, strengthening exercises, that pelvic floor stuff, some stretches, various things that are going to help incontinence related issues are also going to help the erectile issue. And then I'll talk about a little bit later an example of doing shockwave therapy for pelvic floor issues, including erectile dysfunction. And I had a patient, he was, I think he was like mid 70s. And he came in, and for the last 2 years, he hadn't been able to have intercourse and hadn't ejaculated in a couple years. And we did 6 sessions of shockwave therapy with him. And within, I think actually at like the 5th session, he was able to have intercourse successfully and was able to ejaculate for the first time in 2 years.
There must be a bad joke in there somewhere, but I'm not going to make it. I'm applaud.
But it changes people. I mean, really the other thing about pelvic floor issues, whether it's the pain or the incontinence or the erectile dysfunction, all these things that male patients are dealing with, is it increases anxiety and depression. High rates of anxiety and depression in people with pelvic floor dysfunction. Hard to get away from the symptom. It affects your ability to socialize with people. People are, instead of going out and golfing, maybe you're saying, I don't want to leak, I don't want to have these accidents in front of my friends and have to, whatever. So it's all of a sudden you get reclusive and, you stop doing the things you love to do. So,
and it changes your self-image. I'm suddenly old. I can't have sex. I can't go out in public. I can't do this. I can't do that. You just kind of shut down and become reclusive. I saw that with my late father.
Mm-hmm. Yeah. But I think it helps to, know that, 1 in 6 men have these issues.
Right.
So that's 17% of the male population. That's millions and millions of people.
And you're telling me that physical therapy alone, without all these drugs that they're selling, can have an impact.
It can, for sure. Yes, yeah. And even if you have gone, say you do need to, take the drug or get the prostate surgery, which, that's not something you can sometimes avoid.
Right.
Because it's the right thing to do.
Right.
You can still have an impact and improve your recovery by doing pelvic floor physical therapy after you go through those things. So, because it can take a long time to heal.
I've never heard of one male, one of my buddies, one of my dad, anybody else ever. They've talked about some of these issues. If you really press them, or I saw they had these issues, never once did they talk about physical therapy.
Yeah, I know. Well, let's see. I have another patient example here.
Yeah, please.
So this was status post prostatectomy. So the common thing you might come across from people in their kind of usually early to mid 60s are starting to go through prostate surgeries.
Right.
He came in leaking 4 to 6 times a day, just getting in and out of his car, getting in and out of bed, just doing transfers like that.
Right.
Just simple things that we do throughout the day. And about halfway through, he started to notice an improvement. That was about maybe the 4 or 6 week point. And by the time 12 weeks hit, he was like 80% better. Didn't have any of the leakage with any of those transfer movements. If he'd sneeze, if he timed his contractions right, he could prevent it, but sometimes it would just catch him off guard.
Right.
So he had a little bit of dribble, he said, maybe, once or twice a week, because he was able to control things. And he should, if he just keeps doing his exercises and strengthening and everything over time, in another probably month or so,
You
he
got
should
your
be
hand
good.
over your heart. That's the way I feel like, oh
Yeah,
my God.
I know. No, seriously. Yeah. Yeah. It's, there's serious conditions that, once you have eradicated those symptoms from your body and you're able to take control again, it's life-changing. So
Again, I saw it with my father. I feel a little bit of some of these things happen to me. It's embarrassing. You don't want to talk about it. It limits, you start limiting what you're going to do and you can't do. You start not drinking water because if I can't hold it. Oh, I've seen that happen. I probably have done that a little bit. All these things just have a spiral, a downward spiral on your quality of life. And something as simple as physical therapy can have a dramatic effect on this?
Yep.
Wow.
Yeah. Half of it's the education that we give people,
I'll bet.
and then the other half is some of the manual therapy and those kind of things. And for certain people, we'll, like I said, we'll do that shockwave therapy. And we've also implemented using the newbie, which helps to reconnect to
Let's
those
talk
pelvic
about
floor
that,
muscles.
because this whole shockwave stuff is
Yeah.
mind-boggling. Now you're really cutting edge. It's not just manipulate, whatever you
Right.
call this.
Yeah, so some of these areas are difficult to get to with our hands or by touching or doing whatever, and
Yeah.
and the shockwave therapy goes about 4 to 5 inches deep. So we're able to get to these deeper tissues and induce a stem cell kind of healing response in those areas to help people heal more successfully. And if they've seen with I don't have the study, but if we do a prostate episode, I can get some more studies that show the effects of doing shockwave therapy pre and post prostatectomy for better healing.
And I know this isn't what your specialty is. You're not a urologist, but I've heard we had somebody come in and talked about if it does turn into cancer, which is everybody's fear. That's why we get it checked all the time, and they have to go in and remove the cancer. It's a really hard, invasive surgery in a very tender part of your body here. Are people experimenting with shock waves and other things to break up the cancer cells?
So that's I don't know of treating the cancer. So
Breaking the
it's
cells up or
possible
something?
eventually that will be something.
Yeah.
Right now, it's like a contraindication. The main reason is that we're bringing more blood flow into the area, and you don't want to force more blood flow into a cancerous tumor because it helps it develop. Over time, we might see that if we do this, you'd probably start in rats or something like that.
Yeah,
But doing a treatment to a tumor might help to start shrinking it. I don't know that that's true yet, but that might be something over time that gets proven, and maybe we'll be using it for that. But right now, we do not do it on tumors or on directly on that tissue.
Okay, good to know.
Yep. Yeah. So I mean, that's in a nutshell. We're looking at no pun there,
intended. How do you talk about this without laughing, without coming up with something?
Yeah,
That's what most
and
men just want to
It's
giggle.
okay too, but it is it's a very serious condition.
It really is.
But even when people come in, you have to keep it light, and a lot of people do end up, making jokes like that. The patients that come in, make jokes about that stuff, and you have to laugh with them because it helps get you through it.
But it's getting people to openly talk about it, which I think most men don't want to do.
Right.
They don't want to pay attention to it. They just sort of adjust to it and not think about it. Okay, I'm going to leak now.
Yeah.
And they didn't think there's anything really that can be done. That's kind of the general feeling I got. Lucky you. You're 70, you're 80, you're 90 now. This is your life.
Right. Yeah. So I just want people to know that, if they have any of these symptoms, so the urinary symptoms,
Right.
bladder symptoms, which are like the urinary symptoms of leakage
Right.
or urge, or you lift something up and you leak, that kind of thing.
Yeah.
Bowel issues, which could be constipation or some leakage possibly too.
Right.
And then just pain in that area in general, meaning your testicles, your penis, the perineal area, all those areas are potentially treatable with physical therapy. And then, of course, erectile dysfunction as well. So if you have these issues, go see your doctor, or if you know of pelvic health physical therapist like me in your area, reach out. We can actually see people direct access, which means you don't need to get a prescription before coming in.
Oh, okay.
For some of these issues, it's probably nice to have seen a urologist or something just to rule out, some of the other stuff that might be going on. But in general, we don't need a prescription to start seeing you.
And would this be covered under insurance or no?
It should be. Yeah.
Oh, okay.
Yeah. If people have insurance that we're in network with, then yes, it's covered by therapy, by insurance. Yep.
Wow. All right. So how do they reach you? That's the magic
so we're
question.
at Physical Therapy and Balance Centers in Lake Forest.
Let's spell it.
Fyzical.
Okay.
And phone number there is...
Because you're definitely different, so the spelling's going to be different.
Yeah. Well, hopefully it's memorable. Yeah. 949-716-1800, or you can find us online at physical.com/lake-forest.
Full disclosure, I've sent my wife there. I've gone there. It's an amazing group of people. And I look at the people coming in. It's not just knee injuries and back injuries and the other things I've seen in physical therapy businesses here. You're treating a whole range of problems, like we talk about in this show here.
Yeah, we do our best. Yep.
Well, amazing work here. All right.
Thanks, Paul.
Give us the website one more time. I'm sorry.
Yeah, physical.com/lake-forest.
Okay. All right. I look forward to showing prostate because that's one.
Let's do it.
Everybody's
That's a
worried
good
about
idea.
these days.
Yep.
All right. Well, there you have it. We not only made it simple, we made it discussable. We talked about things you probably have experiencing and know somebody is, but you're not paying attention to them, at least if you're me. So let's start talking about them. Let's see if we can't find simple solutions for these problems. Right here on Health Simplified, on Orange County's only community radio station, OC Talk Radio, streaming live from our studios here at the University of California, Irvine's Beale Applied Innovation Center.